Sharwa is just 1 3-year-old among many in Chisona village, Masaka municipality. She should be running around with children her age, but her legs will not allow it. Her arms and most parts of her body are too weak. She feels immense pain from time to time. She was born a healthy child by caesarean section, but her health took a turn when she turned 2. 2 months later, a visit from Sharwa's aunt led to a revelation, something that her mother had overlooked. A neighbor told her that her child was bewitched. She was advised to immediately visit a witch doctor. The 3-year-old appears pregnant, but what she carries in her stomach is not a baby. Sharwa cannot stand for any given amount of time without experiencing pain. But pain aside, it seems as though a mysterious force controls her life. Her mother is convinced that Sharwa has been bewitched. But Sharwa's mother did not know all this. 2 months after her visit to the witch doctor, a visit to Masaka Referral Hospital did not help. She was admitted in Mulago and tests were done after taking tissue from her stomach. The hospital could not hold her against her will, so she left. 2 days later, she noticed a snake-like movement in her daughter's stomach. On worse days, the movement is fast and ferocious. More and more people advised her to keep away from the modern medicine. She believed them and went back to witch doctors. She changed witch doctors and visited 3 more, but the stomach was getting more extensive. That has been Sharwa's journey so far. Her confused mother, Gloria Nyiransaba, has not yet found a sorcerer from Burundi. Pediatric oncologist Dr. Joyce Kambugu has seen similar cases at the Uganda Cancer Institute. Some tests done on Sharwa at Makerere University pathology department suspect the child to have Wilm's tumor.
There are other childhood tumors that could give you that sort of picture. First of all, there are other tumors that can happen within the kidney other than Wilm's tumor. And that is why we can't just look at you and say you have Wilm's tumor. That's why it's imperative that that tissue get taken off, the one I called the biopsy.
Sharwa's mother should hope that it turns out to be Wilm's tumor, a malignant tumor of the kidney, the most common in children. It mostly presents in children under 5. There is no clear cause, but at risk are children born with birth defects. This should be screened through ultrasound every 3 months until age 7 or above. In the beginning, the tumor is painless, and only a keen mother bathing the child may notice lumps. With time, however, a child will lose weight, have unexplained fevers, sweat excessively at night.
Sometimes we'll report an episode of red urine or tea-colored urine.
Sharwa has experienced some of these symptoms. As a toddler, she was a well-fed baby, well on her way to obesity, but now she's thin.
This tumor is a cancer that grows, and cancers are like parasites. So they will feed themselves at the expense of the rest of the body, and if the child is not eating enough, then they will start to break down the child's body mass. Thank you, Uncle. You also need to realize that this wasting is contributed to by what we call squashed stomach, because remember the kidney is growing in the abdomen, and as it gets bigger and bigger, it consumes room. So even the stomach is squeezed so that the baby can only take small amounts of food.
Dr. Kambugu says that it is not too late for Sharwa.
What we do, we give them chemotherapy, and this tumor is usually very chemosensitive. Chemosensitive means it responds well to treatment. So usually what we would do is that we would give them chemotherapy, and this tumor would shrink to the degree that we can now have it, the remaining part of it taken out. And the beauty is that even in Cancer Institute, we can do that. We have the chemotherapy, it's free. We have the surgery, the surgeons are there, the pediatric surgeons, it's free. We have the radiotherapy, it is free.
What this gentleman is doing is not advised, but how can he know this when the child is not in hospital? And it is not helped by a mother who believes in witch doctors.
These medicines that the doctors, the fake doctors, because I'm sure they give them all sorts of things, can they interfere somehow?
And that is why when we have our patients, we counsel them to not mix the two. You might have something that will, when given together with our chemotherapy, would damage the liver or the kidney. The flip side of the coin is nullifying the chemotherapy because it might deactivate it. So at the end of the day, it's like we're giving you chemotherapy, but we are not, because the herb is interfering with its action.
Wilm's tumor is one of the most curable tumors known even in third world countries like Uganda, but only if parents report early to hospitals and resist the urge to go to witch doctors.
I'll tell you, even at the Cancer Institute, once we finish our rounds at 5, 6 p.m. and we go away, by about 8 p.m. then the witch doctors have come to do their rounds also.
Florence Salimba, NTV.